All right. Welcome, everyone. I'm just going to pop back in before I start talking here to make sure that we're all good to go. Looks like we are. Webinar started and everything. So let me go back to full screen. Here we are. So thanks, everybody, for being with us here this afternoon, probably for most of you. I guess late morning for those of you out on the West Coast. Thanks for being with us here today. My name is Phil Bowers. I'm the marketing director here at Grandstream, and we're, as always, really excited to be joining up with our good friends at VoIP Supply to present a webinar to you all here today to tell you a little bit about Grandstream products. And today we're going to be focusing on a topic that's frankly, very timely and very much in the now, creating telehealth solutions with our GXV series of Android IP video phones, which, in addition to telehealth solutions, as we move on, I think you'll really see that these are, in my opinion, one of the most powerful options out there for remote communications, but specifically for remote video communications. So, excuse me, we'll go through the products. I'll give you a little bit of an overview of them, and then we'll start talking specifically about the different features and functionalities that they offer that make them such a great option for telehealth solutions. If you do have any questions at any point in time, feel free to send them over either through the chat or the Q&A in the bottom of your screen. And towards the end of the webinar, at the end, we'll open it up, go through those questions, and take any other questions that might come in. All right, so actually one thing I do want to say before we do get started here on, behalf of everyone here at Grandstream, just want to send out our, heartfelt best wishes to everyone. Hope you all are staying safe and healthy out there. And yeah, stay safe, stay healthy. We're excited and happy that you're able to join us here today. So without further ado, let's get going. So we're focusing here today on our GXV series of Android IP video phones. Before we even look at them from the telehealth solution, these are, in my opinion, some of the most unique, some of the most powerful IP endpoints out on the market from any manufacturer. These are this GXV series of IP video phones we've had out for, I guess, probably now about 10 years, actually. Obviously, there's been a lot of different models, but, the technology goes back quite a bit, and it's been a very, successful line for us. According to Frost & Sullivan, they put out a report a year ago that listed us as the second largest manufacturer of IP video phones in the world. And our current portfolio is these three devices that you see here. On the surface, you'll see the term Android. That's usually the kind of thing that pops up first and that catches everyone's attention. That's what makes these really great devices. They are open Android devices, meaning that we give you full access to the Google Play Store with these devices to download any of those Android apps. And then obviously all of them have video cameras built into them, touch screens on all of them. There's slight differences between the three models, which I'll explain as we go here. But real briefly, you can, I think, tell the difference mainly by just looking at them. The 3380 on the left has an 8-inch touchscreen. That's the largest touchscreen within the series. It also gives you support for full 1080p video input and output. We'll talk more about that in a second. The 3370 in the middle is a 7-inch touchscreen, so it's a little bit of a smaller screen. Does give you, gives you, what was I saying? Yeah, so a little bit of a smaller touchscreen. That's 720p, that's what I was looking for. It doesn't support full 1080p, but 720p, which on a screen like that is really all you need. And the GXV 3350, 5-inch touchscreen, so a little bit of a smaller touchscreen, but gives you the full set of hard keys, which is, for a lot of people, that's something that they're going to want. Also gives you 720p video input and output. So to kind of dive into these devices a little bit more, to really give you an idea of the power they offer before we begin to kind of look at them from the lens of a telehealth solution. As I mentioned, these guys are open Android. You're going to see there are other manufacturers on the market that make devices, IP phones, that they claim to be Android. And in most cases, those devices take Android and they put a couple of preloaded applications onto it and they use it to design the interface, and then they lock it down so you can't get to the Google Play Store, for example. We don't do that. We give you full access to all those apps, the ability to integrate with Google services like Calendar and Gmail and Contacts and whatnot. So it really is the full functionality of an Android smart device on an IP phone. These guys all have built-in dual-band Wi-Fi, which especially in what we're talking about here today makes them so easy to just, literally drop, connect to the Wi-Fi network, and they're set up. They have built-in Bluetooth, which is great for connecting with Bluetooth headsets, or I think in a telehealth example, Bluetooth speakers as well, which we'll touch on in a little bit. All of these guys are going to give you HD video input and output, 1080p on the 3380 and up to 720 on the 3370 and 3350. So just allowing you to have HD video calls, depending on the different platforms that you're using. And that's one of the great things about this device, which we're going to talk about in a second, is the wide range of different platforms it can be integrated with. It's have HDMI input and output, which gives you the ability to connect it to a TV monitor, for example. And then, as I mentioned earlier, all of them have touch screens, either an 8-inch on the 3380, a 7-inch on the 3370, or a 5-inch on the 3350. So I guess you see that the second to last number in the product name tells you how big the touchscreen is. Just kind of wrapping up the intro to these products here. They're all 16-line devices. They support 16 lines and 16 different SIP accounts, which then looking at it from a telehealth example could give, if you have one of these phones in a senior home, for example, you can have it programmed as an extension on the network for the different, healthcare providers or doctors that might be working with the person in that room, so that they all have, direct access to that person. 2-megapixel camera, that's actually on the 3380. The other two guys have a 1-megapixel privacy shutter on those cameras. Dual gigabit ports, integrated PoE. Built in, these devices give you the ability to host a 7-way voice conference or a 3-way SIP video call. So even if it's on a network that doesn't have a video bridge, for example, these guys built in have the ability to host up to a 3-way video call. All right, so now let's begin to look at these guys from the telehealth solutions angle. And the picture that you see on the left there, some of you may have seen this in some of the other content that we've put out. And I think one of the reasons why I was so excited when VoIP Supply came to us with this topic in mind is that this has been a really, really popular topic for us worldwide recently. As I mentioned, we're one of the biggest manufacturers of IP video phones in the world, but in these devices over the last month or so, quite frankly, have been flying off the shelves. And we're seeing lots of examples, and we're finding out about a lot of these just organically, of these GXV video phones being used in hospitals and senior homes and nursing centers and doctors' offices to create a telehealth solution. It'll give you a dedicated endpoint that allows you to hold video calls, to check in, to do, as it says there, the first bullet point, remote medical diagnosis, consultations through video calls from doctors and nurses to remote patients. Lots of different platforms that these guys can be installed on, and we'll touch on that on the next slide. SIP, Android, obviously SIP VoIP, Android, direct IP to IP, and a couple other options we'll cover in a moment. Especially for, in the telehealth solution, you want these guys, these devices, whatever you're using to communicate, to be extremely easy to use. Especially if it's, with older patients or at senior homes. It's especially important that these devices be extremely easy to use. And that's one of the other great things about that we built these with Android, is that it runs an Android touchscreen interface. If you've ever used or have any experience with any type of smart device, phone, tablet, operating this is exactly the same. It's got even features like for a senior home. You'll see a picture, actually you may have seen it already, that you can have a screen that has a pretty big button dialer. Makes it really easy to dial out, for example. Obviously, just kind of, I guess anymore it could be a standard IP phone feature, but have them set to auto answer for hospital rooms or for senior homes or whatnot as well, which is another great tool for safety and security. These devices have built-in Bluetooth, which allows the user to have a lot of different options in terms of how they're going to interact with the audio of this device. Obviously, it's got a built-on handset, which I think a lot of people are going to prefer. It's got a speakerphone, as everybody knows. It's also got Bluetooth, so you could integrate it, for example, with a Bluetooth headset for a doctor or a nurse or somebody in the office that might not be able to just sit at the desk or might want to pick up and show a couple of different things on the video and be able to move around the little room that they're in while they're talking. Also would give you the ability in a room where somebody might not be able to get up and answer the phone to be able to have it set to auto answer and to have the audio synced with a Bluetooth speaker that might be located elsewhere. Mentioned earlier the output video to TV screens. This could be a great little video option for doctors and nurses to use. Basically allows you to create a kind of a little really affordable, simple to install video conferencing solution. Also for an example like a senior home or a hospital room, you could have these video calls be able to be shown on a bigger TV that somebody might be able to see a little bit easier, for example. Our GXV 3380 actually through the HDMI input that it offers gives you the ability to potentially share computer screens or web content through these phones with a remote user to be able to, I don't know, maybe show a health video or a document or a list of tips that an organization may have created. And the other thing that makes these so great for telehealth solutions is that they have Wi-Fi, so they are easy to install. There's no new wiring that has to be run to be able to put these on a network to add video to rooms in a hospital or senior home. They run on Wi-Fi. Obviously, most, if not all, of these types of facilities are going to have Wi-Fi networks already. So here you go. There's no extra wiring. It's easy to just drag and drop these things. If you're, there's a variety of ways that you can have these, specifically with our GDMS platform, which I'm going to talk about at the very end of the webinar, ability to have them, as soon as they were dropped in a hospital or a senior home and connected to the Wi-Fi network to have them instantly provisioned essentially by GDMS. So that's kind of a quick little overview there of the many different reasons that make these devices, our GXV series, such great options for telehealth solutions. And I got a couple of slides to go into some of this in a little bit more detail. And one of the things that I like that VoIP Supply really promoted a lot about these devices in the promotion of the webinar is what you see here on the screen. The fact that, these are the term that we use or that I use a lot is flexible, that there's a wide variety of different platforms, a wide variety of different ways that these you can install and deploy these devices. Essentially what I'm getting at is it should work with pretty much any VoIP or SIP solution or network out there. Whether you're using a SIP or a VoIP service or platform, an internet telephony service provider, a managed service provider, and anything along those lines, a hosted platform. And as you see in the bottom left there, these devices are officially certified with Cisco, BroadSoft, and Metaswitch platforms. We're in the process of finalizing 3CX Port 1. There are essentially, these devices will work on pretty much any SIP or VoIP platform that at least supports video pass-through, which in this day and age, the majority of them should. So it really is a flexible SIP-based video solution that should work on without any issues on any SIP or VoIP network. It'll work on any IP PBX that supports video or that at least supports video pass-through. And obviously, we're always going to promote our own UCM series of IP PBXs, a license-free set of PBX of, call it a PBX. It's a unified communications manager. It's got hundreds of features built into it, no licensing fees, full video support. But obviously, we're realistic and realize not everyone in the world uses a UCM. So it'll work with any IP PBX and SIP PBX out there. In addition to our UCM series that supports video or video pass-through. Because the device has Android built in, it'll work with any Android app. You don't even potentially need to give it a SIP account if you're going to use it in that sense. It's, just give it a connection to the Wi-Fi network, set up Hangouts or whatnot, or any other type of video chatting app, and there you go. Obviously, the other, this goes with any IP endpoint, but specifically for a solution like this, in a hospital or in a senior home, where maybe security or the ability to, maybe security or whatnot is a larger concern. Set it up for just direct IP to IP so that a doctor in one office can just pick up the phone, press a button, and make a direct call to the IP address of patients in their room or at the senior home or whatnot, and have the ability, so the device from one side only has the ability to make and receive calls from certain IP addresses. Beginning to, what are we at? About 17 minutes in. So yeah, I think we're planning to go for about 25 to 30 minutes. So beginning to wrap up here. Let's give you some telehealth deployment solutions. I've touched on a bunch of these as we've gone, but to just kind of, mention them specifically and to go into more detail. We've got obviously hospitals and multi-site healthcare organizations. These guys are great tools to allow remote video communications from different buildings or different rooms within a hospital to allow doctors to communicate with nurses or patients without having to, especially in this day and age, without actually having to go see them in person. And I've got a case study that I'm going to wrap up the webinar with in a couple of minutes. Really big solution within the senior and veteran living facilities, which are, obviously of really major importance, especially now, which at least here in the US seem to be kind of a source of where the virus seems to be spreading quite a bit. And these tools give, these residents the ability to get medical diagnosis and consultations remotely, especially for, maybe things that aren't at the level that might require you to go to the hospital, but that still needs to be dealt with. It's a great option for senior and veteran living facilities, doctors' offices, especially, a lot of smaller local doctors' offices. These devices give them a desk phone that they could use to hold video consultations with their clients, or patients, excuse me. And the other great thing, which there's a bullet point on the bottom about this, which I should probably mention, it's a good example with the doctor's office scenario, is that because this device runs Android, you could have this desk phone for a doctor, for example, or a nurse in their office at the hospital or at the facility, and allow them with this device to communicate with people through Android apps, to make video calls where the doctor, the nurse, or essentially one side of the party of the call has this device and the other side can be running an Android app on an Android, or can be running, an Android app on any smart device. Another big thing that, at least that I've seen quite a bit around here, which I think this is a good solution for, is a lot of the, I don't want to call them non-essential healthcare organizations or operations, but some of the, the ones that are not fully operating right now because they, might not be deemed as fully essential. What I mean by this is like a dentist or a chiropractor or a physical therapy office, which, a lot of them from what I've seen, if they're not closed, have severely cut down and are basically only taking emergency situations, where this would give them the ability to, go into their office or from their home to have a dedicated video endpoint that they could have video consultations with clients just to kind of touch base with them. Especially, I think, for dentists, I could see this being a really great tool because of the video that it offers. So yeah, and again, with the Android apps, there's a lot of different ways to be able to make video calls with these devices that can be attended by others that might not have a Grandstream device. Apartment buildings, which is, a lot of apartment buildings have, especially in this day and age, kind of not monitored or managed, but people are a little bit weary of coming and going, and maybe don't want to go out to see a doctor unless completely necessary. This could be a great option to put in common areas or to provide to different residential facilities to add a remote or a telehealth option for residents of those buildings. What else do we got here? Talked about the Android apps throughout here, and the video calls. But another great thing about these devices, I think, especially and it's just something, good to mention here, especially for something like a senior facility, which is actually I think this is covered in the case study that I'm going to tell you guys about. That these video devices, if you put them in a hospital room or if you put them in rooms at senior homes, could actually then communicate, essentially create a little video intercom connection with our GDS series, which could essentially manage access to any facility and allow users or these Grandstream GXV phones in resident rooms or in hospital rooms to actually allow somebody to chat with someone who's trying to get in and to actually push a button on the GXV phone to let them in through the GDS device. So another little solution that can be built with this that I figured I'd mention. But of the biggest ones that we have seen, and you can see it in the picture, are certainly hospitals, healthcare organizations, senior and veteran living facilities who are using these to be able to allow residents to basically have access to remote medical consultations, diagnosis, assistance, whatnot, especially in this era where even, being within 6 feet of somebody is a concern, unfortunately. So here's that case study that I was mentioning, and it looks like we're pretty much right on time. I've got another, I believe, 2 slides, and then we're going to wrap up here. And then we can start to go through the Q&A. So this slide that you see here on the screen is actually taken from our Grandstream partner conference that we held last September? Yeah, last September down in Cancun, Mexico. We do that international partner conference every 2 years, bring in our partners from across the world and kind of talk about what's the latest and greatest with Grandstream, what's coming up, and kind of try to, help create a environment where everyone can kind of help everyone else. And one of the things we did this year was, and actually no, we've done last two events, we've done a case study showcase where we'll take the 5 or 6 best Grandstream deployments, we'll get the partners involved who facilitated them, and we'll bring them up on stage and talk about them. And this was one of the 5 that we covered at last year's conference. BNS, one of our partners in the UK, has worked with senior living facilities throughout the entire country to set up telehealth solutions, remote medical solutions with, I believe they've deployed close to tens of thousands of devices for tens of thousands of senior home, or excuse me, really stumbling over this, for tens of thousands of users in senior facilities across the United Kingdom. So yeah, the assisted living private nursing home. And so in addition to, we've talked a lot about today, the telehealth, the being able to get remote medical diagnosis and consultations, and all the different video options it supports to do that, and the Wi-Fi that makes it such an easy thing to install. But the other thing that really makes these such great options for senior homes is the term that they use was social inclusion. Because their Android device, it's a smart device. It gives you full access to all the apps and a web browser, and a wide variety of different ways to keep up with the world, to communicate with others, to surf the web, to get all types of tools and resources available right here on the same device that these residents are also going to be using for to potentially let people in the building, to have appointments with doctors and nurses remotely, all that kind of stuff. So wanted to highlight this to show you that, even before the world turned into what we are going through today, this was a really popular solution. And as you can see from this example in the UK, with tens of thousands of devices deployed for tens of thousands of senior users throughout the United Kingdom. You can download, or it's not download, you actually can see the full written case study at the URL at the bottom of the screen, content.grandstream.com/bns-video-phone-case-study. I should have just let you read it because it was a lot to say. All right, yeah, so that's, a little to kind of bring the whole discussion home. There's a little case study. Definitely go check out the full written example of the case study. It goes into more reasoning why they picked it. Obviously, we talked a lot about the remote, the telehealth solutions, but definitely also in this case wanted to highlight the kind of full smart device functionality that it offers, the social inclusion, the social media, web access apps, different ways to chat and keep up with others. All right, so as we begin to wrap up here, just real quickly, and you've kind of seen throughout, and I mentioned it earlier, taking it in addition to the telehealth angle, these GXV video phones, in my opinion, are some of the best remote work tools out there for any industry. Obviously, we just gave you, for the last half hour, some really great examples of what this video, this Wi-Fi video SIP Android device can do for telehealth solutions. But obviously, when you combine all of those, the video calling, the Android tablet functionality, the video or the HDMI that it offers, the Bluetooth support, Wi-Fi, it's a great option for anybody working from home or working remotely to stay in touch with others, to have a really powerful communication device that gives them the full functionality of Android, little video conferencing solution, and a desktop video calling phone as well, with 16 lines built into it. So figured I'd just mention that real quickly. Last slide here before we wrap up. While we're talking about remote management or deployment of these devices, just want to wrap up by kind of mentioning our GDMS platform here. And in the case of telehealth, what this would allow a hospital or healthcare organization or senior home to do is it allows their IT teams to very quickly and easily deploy these devices. And if these devices may be being deployed remotely, so a hospital that has multiple different locations, or a senior home that has multiple different locations, from this central cloud location, the devices can be set up, provisioned, managed, monitored, set up processes for automatic maintenance and updates and whatnot. And to give you an example of just really how easy this makes it for deploying a remote device, and you see it there, it's really 2 steps. The IT administrator would configure the device on the GDMS portal. The device gets shipped to where it's being used. Somebody at that location just connects it to the Wi-Fi network or the wired network if you're doing that. Automatically shoots back to GDMS and picks up the config and is ready to go in a matter of minutes. So just wanted to mention GDMS. It's a great platform to manage these video phones for telehealth solutions, especially when they're being deployed and used remotely.
All right, so thank you everybody for joining Grandstream and Phil and all of our and VoIP Supply for this really informative webinar. As mentioned, we will get this out to you guys as soon as possible. And if anybody has any other questions, we'll have one of our solutions consultants emails and contact information on that email, so you can reach out to him directly for more if you have any more questions. So with that said, thank you everybody. Stay safe. Same with, just want to extend everybody from VoIP Supply as well that we hope everybody's staying safe, and we're here to help you guys help your customers. So reach out to us at any time.